The first stakeholder I will be presenting is the federal government. In accordance to Canada's Health Act, the federal government is primarily responsible for providing healthcare services towards members of the Canadian Armed Forces. It is a responsibility to protect, promote, and restore individual well-being by providing accessible healthcare services. However, it is also their obligation to consider the members' families and the nature of enlisting with this service. As to be expected, frequent geographic relocations and work-related separations can challenge the health accessibilities of families. By collaborating with military family services to ease the transition and accessibility of healthcare services, these issues will then be resolved. However, if the federal government were to individually get involved in providing healthcare accessibility to members' families, this would disrupt the legislative effects placed by the Canada Health Act. This could then lead to inefficient quality of patient care due to an increase in patient load, expenses, and utilities, along with the disruption of patient profiles between federal and provincial/territorial governments. Therefore, the federal government strongly recommends that civilian families access the military family services with the support of provincial/territorial government. Two arguments arise to support this position. The first argument lies with Canada's Health Act administered for provincial and territorial government. Passing the Canada Health Act sets conditions and criteria based on portability, accessibility, universality, comprehensiveness, and public administration to health services. The aim of the Act is to ensure that all individuals residing in Canadian provinces and territories have reasonable access to medically necessary services on a prepaid basis. As this Health Act states that healthcare is portable, this should not significantly impact families that consistently move from one location, a province per se, to another. Residents moving from one province or territory to another during any waiting period for up to 3 months should be covered from their home jurisdictional province or territory. If a family stays for more than 3 months, they must then register with the healthcare insurance plan of the new province or territory. That being said, the federal government is not required to specifically fund and support families of members from the Canadian Armed Forces, as they are already being provided and insured by provincial and territorial governments. In the event families cannot find or secure a family physician, they can experience lengthy wait times for referrals and specialized care. However, services from external stakeholders can help mitigate and solve this issue, which brings us to our second argument. The second argument lies with the support provided by internal and external stakeholders, specifically by the Military Family Services. The Military Family Services, on behalf of the Department of National Defence and Canadian Armed Forces, work with other external stakeholders to offer programs to improve access to quality healthcare services for members' families. They primarily work to support families in obtaining and securing family physicians over a short period of time. These services are of no cost to families and are easily accessible upon request. Furthermore, they can easily support and keep track of patient profiles without going through the hassle of involving the federal government. Having families take this route towards achieving healthcare will alleviate the stress and financial burden the federal government has to undergo when expanding their scope of care. Therefore, with both these arguments mentioned, families do not need to receive healthcare services from the federal government. According to this information, I believe that military families are better off relying on the services provided by the provincial and territorial governments. There are a lot of problems that arise upon the introduction of military families receiving health care from the federal government. Not only would it disrupt the quality of patient care facilities, but this would also impact the way governments provide and administer health and health insurance. This would also disturb the equality and equity of healthcare services given between governments, as taxpayers now play an additional role to further fund for these individuals. Overall, I strongly suggest that these accessibilities should not be given to military families.
My name is Aska Alam, and I will be presenting the second stakeholder, family members of military personnel. It has been determined that more than 57,000 families of individuals in the Canadian Armed Forces, CAF, access healthcare services through the provincial and territorial system from public healthcare providers. As these families frequently relocate inter- and interprovincially, it becomes difficult for them to receive continuous healthcare. As a result, various important medical treatments may be withheld, and it may take longer for them to meet with a specialist. In comparison, members of the CAF receive healthcare through the federal defense healthcare system. This system is known to be well organized, highly specialized, and continuous. Nonetheless, many CAF families are concerned with the quality of healthcare they are receiving from the provincial and territorial system due to their military lifestyles. They are often faced with many distinct and notable barriers in their access to medical treatments. However, these barriers can easily be removed if the military is to provide healthcare to members' families. CAF family members would benefit from this change, as it could prevent unnecessary visits to the emergency department, ED, and allow children and youth in CAF families to use more healthcare services. My first argument includes the lack of access to timely health services for CEF families. As previously stated by Mason, families may experience lengthy wait times regarding referrals and specialized care. Mason then mentions that these issues can easily be solved with the help of internal and external stakeholders, such as military family services. I would disagree to an extent since other factors need to be considered in that argument. Although programs offered through these services improve access to health care, they will not be able to support all the military families across Canada. Let's take a look at the numbers. In a study conducted by Maher et al. In 2018, it was determined that military families had to wait longer intervals compared to civilians to first contact a healthcare provider. It was 118 versus 83 days. Wait times to see a specialist were also longer for military families. In addition, twice as many civilian families were able to meet with the pediatric specialist, non-pediatric specialist, and pediatrician compared to CEF families. These longer wait times can disrupt ongoing treatment and previous gains made by family members of serving military officials. Healthcare provided by the federal defense system could solve this issue, as it would allow for the continuity of care and save the hassle of transferring medical records. The second argument relates to the availability of healthcare providers. Many military family members are forced to travel to their previous postings to meet with their family doctors, since it can be difficult to secure a doctor in their new location. This process can be costly and time-consuming. Family doctors are important as they can provide necessary prescriptions and referrals to specialists. Some patients may even have to be re-diagnosed in their new province to receive any further therapies. Consulting a physician can take years for many military families. Hence, their reliance on EDs and walk-in clinics for healthcare can reduce measures for preventative care, leading to complications and frustrations. Healthcare provided by the military for members' families will prevent extra costs for military families considering private therapies, and it would save their travel costs. Half of the Canadian military communities are located in isolated, semi-isolated, and rural locations where specialists may not be available. As a result, military family members may have to travel long distances to meet with specialists for serious conditions, such as uncontrolled diabetes and cancer. Access to only EDs can lead to anxiety about long-term health effects, and navigating new healthcare systems can be stressful for military family members. Since these families live close to the CEF bases in the province, it would be more appropriate if they receive healthcare directly from the military at their base. This would allow for decreased wait times to enter the health system, and it would improve their overall health outcomes. The federal defense healthcare system should be responsible for providing health services to the family members of military personnel. These families lack access to timely care due to long wait lists after relocating, and they are unable to consult with family physicians or specialists in their new community for years at a time. Such barriers can result in poor health outcomes and prevent the continuity of care. It is important that military family members feel they are valued in society, since many feel they are not receiving fair and equal treatment.
My name is Fatima, and I will be presenting the provincial and territorial government as the third and final stakeholder. The provincial and territorial governments are responsible for administrating and delivering most of Canada's healthcare services. The health insurance plans they provide are expected to meet national principles set out under the Canada Health Act. Military families are directly impacted by the equality of healthcare provided to them through the provincial or territorial healthcare system. Military families feel as though they are neglected through their transition of relocation intra- or interprovincially, due to the gaps within the healthcare system. The healthcare system is required to meet the standards of public administration, comprehensiveness, universality, portability, and accessibility mentioned by Mason earlier, catering to the medically necessary needs of all provincial or territorial citizens in accordance to these standards as the government's highest priority. Since the provincial or territorial government receives health care funds from the federal government, they should not be burdened with the task of altering healthcare services to better accommodate military families, as this can create problems for other Canadian citizens and possibly affect the standards they are required to meet under the Canada Health Act. The first argument to support my position pertains to the amount of funds and resources available to the provincial and territorial governments to create a healthcare system encompassing all the standards mentioned earlier. Since medically necessary services are not defined in the Canada Health Act, provincial and territorial governments are tasked with the job to determine which services are medically necessary for health insurance plans with the consultation of physicians and other healthcare organizations. If a certain service is deemed medically necessary, the full cost of the service must be covered by the public health insurance plan to be in compliance with the Act. If a service is not considered to be medically required, the province or territory need not to cover it. For this reason, the provincial and territorial governments should not implement further assistance plans for military families, as this can be disruptive to all other medically necessary services that are currently being provided to other Canadian citizens. The provincial and territorial governments recognize the battles military families endure. However, the portability standard accomplished by healthcare insurance plans aims to aid in a smoother transition for the relocation of families inter- or intra-provincially. Any other forms of assistance need to be administered by other internal or external stakeholders such as the federal government of Canada or the Military Family Services. The second argument to support my stance includes equality for all Canadian citizens throughout the nation. If the provincial and territorial governments implement changes in the current healthcare plan to better accommodate military families, many public issues can arise. Other provincial communities can demand services that will better accommodate them. It is important for provincial and territorial governments to serve their specific province based on the needs of the community as a whole instead of picking and choosing the community they wish to serve better over the other. Furthermore, even if one province or territory chooses to integrate better quality healthcare for military families, others may not. This would create further complications in the healthcare system throughout the nation, as there will now be military families who receive better quality healthcare services over other families, dependent on where they get relocated. For this reason, the federal government should be responsible for developing better healthcare outcomes for military family members since they are already paying for healthcare costs of the members of the Canadian Armed Forces. Based on the arguments I have mentioned, the provincial and territorial government should not fund for better quality healthcare for Canadian Armed Forces family members. Although the frustrations of frequent relocations and the quality of provincial and territorial healthcare provided to military families as a result are acknowledged, this is an issue that needs to be addressed by other stakeholders such as the federal government and military support organizations such as Military Family Services. These stakeholders can provide better solutions and outcomes for military families on a larger scale.